This is David Holt with a little lecture on how to calculate the volume to be infused to program into an IV pump to give a full dose of IV antibiotics. There's a simple rule for small bags of IV solution when you're giving a secondary. You can use Holt's 30cc rule. You simply add 30 cc's to your smallish bag of say 50 cc's. That'll give you 80 cc's to program into your volume to be infused section of the IV pump, and you should be able to give the full dose of the medication, antibiotics or whatever. Once you get up to 100 cc's or more, you probably need to think a little deeper and do a more complex calculation even. And the formula is as follows. I think I'll need to take a sip of tea before I give this one to you. Excuse me. No, I won't. The formula. It's the mainline IV tubing, which is usually about 22 cc's. The secondary IV tubing volume, which is usually about 8 or 9 cc's. Any additional extension set that you have attached to your IV access. Any dead space in your IV access, if you have a central line or a PIC, that's usually 3 to 4 cc's. The bag that you are infusing, the volume of that bag, it could be anything up to 250 cc's if it's vancomycin, plus 10% of that bag, which is the typical overfill. So you've got about 6 different numbers to add together, and the rough numbers which are going to come out for most people giving IV antibiotics or other solutions, the 100 cc bag will usually need to be programmed to infuse for about 140 cc's. A 200 cc bag will typically need to be programmed for about 250 to 260. The 250 cc bag, because of that 10% overfill, which extends or increases the difference between the bag volume and what you need to program into the pump, that volume to be infused will be somewhere around 315 to 325. But I recommend you get a piece of paper, plot in those numbers for the pieces of equipment that you're using at your facility and for this particular patient, because not every patient will have an extension tubing, and that will give you your numbers, which you can keep in your trusty pockets, and you can refer to them, and you may never need to calculate them again until your swine of a hospital or nursing facility changes IV pump suppliers and you find yourself using a primary IV set which might have 18 cc's and the secondary may only have 6 cc's. There's one IV pump, for instance, which only has a 5.5 cc IV line capacity, and nurses tend to simply program that pump for exactly 100 cc's if the bag is 100, and they throw away the rest. Now if that bag of medication included an overfill with actual medication in it, that would be fine. But if it was a vial with exactly 1 gram and you've got 110 cc's, you cannot waste any of that liquid. So you must put a bag of compatible liquid at the top of that IV set, and those IV sets tend to come just as single sets with not even the possibility of a secondary, and so you need to flush it through with a small bag of IV solution. So that's it for calculating it. Make your notes or go to my website rn-ivpb.com or to one of my books. Just look up David Holt IV books in your favorite search engine.